Assalamu alaikum, dear audience. I am Professor Shamsuzzaman, Professor of Pathology, Rangpur, Bangladesh. Today, I will discuss about intracellular accumulations and NET. And NET. Now come to intracellular accumulation first. Now come to intracellular accumulation first. What do we mean about intracellular accumulation? It is one of the response of cell to stimulus. It is one of the responses of cell to stimulus. What is the definition of intracellular accumulation? Excess accumulation of endogenous substance in cell or simply accumulation of exogenous substances in cell is called intracellular accumulation. So, excess accumulation of endogenous substance in cell or simply accumulation of exogenous substance in cell is called intracellular accumulation. Now come to types of intracellular accumulation types. One is endogenous intracellular accumulation. Endogenous intracellular accumulation. And another is exogenous intracellular accumulation. First come to endogenous intracellular accumulation. What do you mean by it? It means excess accumulation of endogenous substances. Excess accumulation of endogenous substances. Excess accumulation of endogenous substances. Like, what are the substances? Like lipid, protein, carbohydrate, bilirubin, calcium. Dear audience, you know excess accumulation of lipid in cell is called fatty change. It is called fatty change. So fatty change is nothing but one of the endogenous intracellular accumulation. When fatty change occurs in liver, we call it fatty liver. Dear audience, lipid, protein, carbohydrate, etc. normally present in our cell cytoplasm. If the normal amount become excess, this excess accumulation of this endogenous substance is called endogenous intracellular accumulation. So if calcium is deposited in the cell, it is called calcification. We know two types of calcification, dystrophic and metastatic. Metastatic calcification is an example of intracellular accumulation, endogenous type. Now come to what is the cause of endogenous intracellular accumulation. Cause of endogenous intracellular accumulation. What is the cause? Dear audience, you know, within the cell there is nucleus and there is cell organelles like this, and within the cell there is normally lipid present, protein present, carbohydrate present. If the degrading enzymes of that substrate is deficient, then there will be accumulation. Or if there is absence of the enzymes that should degrade the substrate. So what is the cause? Number one cause is deficiency of enzyme to degrade the substrate. This is the cause of endogenous intracellular accumulation. Another cause, absence of enzyme to degrade the endogenous substrate. You know, there are many diseases, inborn error of metabolism. There is, since birth, there is absence of enzyme. So these are the either deficiency of enzyme or complete absence of enzyme, as in inborn error of metabolism since birth. These are the causes of endogenous intracellular accumulation. Now come to another type, exogenous intracellular accumulation. Exogenous intracellular accumulation. Exogenous intracellular accumulation. Accumulation of exogenous substances in cell. Accumulation of exogenous substances in cell. Dear audience, what are the different exogenous substances that may be accumulated in the cell? Like carbon, silica, tin, asbestos. So these are the exogenous substances that may be accumulated in the cell. What is the cause? Cause of exogenous intracellular substances. Cause is absence of enzymes. Absence of enzymes to degrade the exogenous substrate. So absence of enzymes to degrade the exogenous substance is the cause of exogenous intracellular accumulation. Dear audience, you know, we have no enzyme to degrade carbon in our body. We have no enzyme to degrade silica in our body. There is no enzyme to degrade tin in our body. There is no enzyme to degrade asbestos. So if carbon, silica, tin or asbestos enters in our body, if it enters in the cell, it is never been degraded, rather it is accumulated in the cell cytoplasm. When now come to example of an exogenous intracellular accumulation. If anybody inhales carbon, this carbon is engulfed by alveolar macrophages. Suppose this is the alveolar macrophage. This macrophage engulfs the carbon like this. When this macrophage comes out from the lung in sputum, we can identify that carbon-laden macrophage. Accumulation of silica within the cell, it leads to silicosis. Accumulation of tin in the cell, it causes or leads to stenosis, and accumulation of asbestos is leads to asbestosis. So these are the examples of exogenous intracellular accumulation, and this is all about the intracellular accumulations, both endogenous and exogenous. Now come to NET. NET. It is an abbreviation. It stands for neutrophil, extracellular trap. Neutrophil extracellular trap. What we mean by NET? Dear audience, what happens in infection? If infection, what happens? The neutrophil, what happens in infection? Neutrophil acts as phagocytic cell. This phagocytic neutrophil, in case of infection, what happens? From the neutrophil, the cellular material come out. Cellular material come out from the neutrophil. So if this is the neutrophil, and there is infection, what happens? The cellular material come out. So these are the cellular materials comes out. This cellular material in infection makes a meshwork. This make a meshwork. So this is the meshwork. This is the meshwork. And this meshwork made by the cellular materials of neutrophil traps the infective agent. What it does? This meshwork traps the infective agent. And this is called neutrophil extracellular trap. It is called neutrophil extracellular trap. Dear audience, what happens in septicemia? Again we can recall, in infection, neutrophil acts as phagocytic cell. The cellular materials of neutrophil come out and make a meshwork. What is the role of meshwork? The meshwork traps the infective agents, and this is called neutrophil extracellular trap. What happens in septicemia? Dear audience, we know septicemia means bacteremia with multiplication. Presence of bacteria in blood is called bacteremia. and if there is multiplication of bacteria in the blood, it is called septicemia. So septicemia means, again we can recall, bacteremia and multiplication of bacteria, is called septicemia. So what happens in septicemia? Septicemia. Now we get the bacteria within the blood. What happens in septicemia? In septicemia, neutrophil cytoplasmic material comes out in the blood and meshwork is formed within the blood. In septicemia, neutrophil, extracellular trap is formed in blood, and this trap or this meshwork traps the bacteria, and this is meshwork, and it traps the bacteria in septicemia. Again we can recall, in septicemia the meshwork is formed within the blood, and this meshwork tries to trap the bacteria within the blood. So suppose this is a blood vessel, and there is septicemia, and formation of NET, neutrophil extracellular trap formation. This trap or this meshwork makes trap. You know, within the meshwork there is nuclear protein also. So within the meshwork there is nuclear protein of neutrophil. So dear audience, in the meshwork there is nuclear protein of neutrophil. This nuclear protein of neutrophil is very much known to our immune system. Immune system can recognize this nuclear protein present in the meshwork made by the cellular materials of neutrophil. This nuclear protein is very much known to our immune system. Sometimes this immune system cannot recognize this nuclear protein of neutrophil, and this immune system at that condition produces antibody against this nuclear protein, and this is called anti-nuclear antibody. Sometimes what happens? Sometimes nuclear protein of neutrophil is treated as antigen by immune system. What happens there? Then antibody is formed against this protein. Antibody is formed against the nuclear protein. Antibody is formed against the nuclear protein. So if this is the neutrophil, material comes out, meshwork, and this is the nuclear protein NP nuclear protein. If this NP is treated as antigen, then there is the formation of antibody against it. Antibody against NP, and this is called antinuclear antibody. We can cite an example of this antinuclear antibody. Antinuclear antibody in systemic lupus erythematosus. So in SLE, we can get this such type of antinuclear antibody. It is nothing but antibody against the nuclear protein present in mesh made by the cellular material of neutrophil in infection. So this is all about the NET, nuclear extracellular trap. Dear audience, today up to this, thanks all.